all SRMC employees and all volunteers and all who care about Southeastern Regional Medical Center and the fast-paced future of healthcare. My name is Faye Caton. I am chairman of the Southeastern Regional Medical Center Board of Trustees, and I want to speak with you about exciting news for the future of our organization. I have been associated with SRMC for 17 years, 12 years as a member of the foundation board, and this is my 5th year as a member of the SRMC Board of Trustees. My nursing background has guided me in my love for SRMC, and I am passionate about all of us giving the best health care for our community. We have all experienced tremendous growth in the past 17 years that I have been involved and what progress we have made. If you can bear with me for a few minutes, I want to review some of the accomplishments that we have had in the last 17 years. Number one, we built this 7-story bed tower building with 168 private rooms with baths. We had the opening of the Southeastern Heart Center managed by Duke University, which is currently ranked #1 in North Carolina by Health Growth for our heart patients. We have opened Gibson Cancer Center. We had the opening of the Southeast Hospice House. We have expanded the Southeastern Lifestyle Fitness Center and Spa. We have made improvements to Woodhaven Nursing, the Rehabilitative, and the Alzheimer's Care Center. We have opened the Southeastern Wound Healing Center in partnership with Healogics. We have home health and home care services. We have secured a mobile medical clinic, which was funded by Golden Leaf Foundation, and that travels all over our county. We have physician services to include family practice clinics, specialty clinics, new clinics throughout our community and in neighboring communities. We have had rapid growth and expansion of Southeastern Health Mall, which is on the campus of Biggs Park Mall. There we house Duke Cardiology and the Cardiovascular of Lumberton, the Duke Neurosurgery of Lumberton, the Southeastern Surgical Center, Southeastern Weight Loss Center, the Community Health Services and Diabetes Community Center, the Southeastern Express Lab, Southeastern Pharmacy Lab, and the Pharmacy Care Clinic, and the newly opened Southeastern Urgent Care of Lumberton is at Biggs Park. And we're really proud of all those accomplishments. As I have said, we have had tremendous growth in the past 17 years. And I can only imagine what the next 10 years will bring for us. Now on the horizon, we have the new construction of the Southeastern Health Park and Ambulatory Surgery Center, which will be built on 26 acres on Dawn Drive on the Service Road. We hope to break ground this fall, late fall, and be completed by 2013, the latter part. Phase 1 of the health park includes a 4-story building to house 4 operating rooms, 2 procedure rooms, and a comprehensive orthopedic center, a GI center, pre-admission testing, and a pain management clinic, plus retail space. As you can see, we are more than a regional hospital. We encompass many facets of healthcare, and our strategic plan for the future of healthcare for our community is aggressive. SRMC is recognized as a leader in modern healthcare. We are no longer seen as a community hospital or a regional hospital. We are really focused and positioned to be a full system provider and have specialists that will expand in our geographical service area. SRMC has evolved beyond a medical center. Our different locations, the different types of facilities and practice areas represent a broad reach that cannot be communicated in a singular approach. We want to reflect a broader scope of healthcare services for our community. With the leadership of our CEO, Joanne Anderson, and the administrative team, we will progress efficiently with lots of diligent work for the fast-paced change that we are facing in healthcare. We are fortunate to have this excellent leadership team to guide us to the next level of healthcare, which the challenge will be better health, starting with you. For these reasons, the Southeastern Regional Medical Center Board of Trustees has elected a future vision for our healthcare to encompass all areas in a name change to better exemplify our large area of care. To recap a little history of our hospital, in 1946, the Baker Thompson Memorial Hospital formed after a merger with the Baker Sanatorium and the Thompson Hospital. In 1953, Robeson County Memorial Hospital opened on a newly constructed hospital to replace the Baker Thompson Memorial Hospital, and that's where we are now. 7 years later, in 1960, the hospital was renamed Southeastern General Hospital. 34 years later, in 1994, it became Southeastern Regional Medical Center. It is now 18 years later, and I am happy to announce the new name changed today, August the 21st, 2012. And Joanne is going to show the name. I thank all of you for your
If you can't see the board, we'll we'll show that to you in just a little while. But the new name for our organization is Southeastern Health. Simple. Southeastern Health. I want to be the first to recognize and to introduce to you the leadership of your new Southeastern Health. They may look very similar to you or familiar to you. From the administrative team of Southeastern Health, if you would just raise your hand and wave. We still have Thomas Johnson, Reed Caldwell, David Thunder, Andy Schwartz, and Teresa Barnes, who will be leading us from an administrative perspective. Very like you to come forward, sir. This is the excellent team that you heard Ms. Caton speak of earlier. I'd also like to introduce and recognize members of our Southeastern Health Foundation Board of Trustees. There's several of them sitting up front. I know many of you in the back can't see them, but we're appreciative that they're here. They are our greatest supporters, our biggest cheerleaders, and are often out there in the community acting on our behalf. So we appreciate them being here this afternoon. I'd also like to introduce you to our Southeastern Health Board of Trustees that are present today. They too are sitting up front. These are the people who had the bold initiative to make this change. They recognize that from our community perspective, the name Southeastern Regional Medical Center often meant to the community the hospital. And you heard Ms. Caton talk about all of the things that this organization has under its umbrella. We are much more today than a hospital. We go beyond just these hospital walls. We go beyond this main campus to encompass all of the things that she talked about earlier. Our vision for the future actually includes a lot more than what we... Our vision for the future actually includes not only what you've heard today, but many other things. And I want to take you back to the tagline, and then I could ask the administrative team to kind of step aside for a moment. All right, you can leave. We have a tagline associated with this new name, and that tagline says, "Better Health, Starting with You." That particular name has many meanings behind it. That tagline is going to be used for many, many different initiatives going forward. For those of you that are here as staff members, you've heard me say this before. As a healthcare entity, it's our responsibility to be the example for the community and to promote health in the community. I firmly believe that. We have a part of our mission statements and actually our strategic plan that says that we will be a catalyst for improving the health status indicators for our community by 20% by 2014. I'm not sure that we're going to meet that particular goal, but I know that we're on a journey today in that direction. Better Health, Starting with You, is the beginning of that. It's a journey that I've invited each of you to take with us as we go forward. And I don't mean just those of you that are in this room, but those that are employed by Southeastern Regional Medical Center and Southeastern Health. I'm talking to everyone in our community, and I will tell you that today we are actually participating, you are participating in another first of Southeastern Health. Today we are being broadcast on the World Wide Web, across the internet. Anyone in the world can be watching what's happening here today. It's a significant event, significant enough for each of you to take a pledge today that you will commit to helping improve the health status of our community through your life, through your leadership, and through your efforts. We have members of our elected officials with us today. I see Mayor Pennington. I know that Representative Garland Pierce is with us, Eric Hackney, and there may be others that are in the audience today. My challenge is to you that as civic leaders in our community, that you step up to the plate and ask us, commit us to the challenge of improving the health status of our community, not just across Robinson County, but across our entire service area. If you look at the health statistics today for Robinson County, in the state of North Carolina, we are ranked 99th. There are only 100 counties in North Carolina. Columbus County is ranked 100. Lake County is 97, Caton County is 91. We're in the bottom 10% in health status in our service area. That is not something we should be proud of. Our vision at Southeastern Health is to keep at the forefront that health is what it should be all about. This organization stands for health. Our tagline says, better health starting with you. And it's our commitment to this community that we will partner with anyone who's willing to step up to the plate and say, we're on this journey with you. It's for individuals who are willing to say that I'm willing to make a stand in my life to change my health and my risk factors. To those who are employers, I encourage you and challenge you to step up to the plate and say to your employee base, we can be healthier than we are today by taking small steps along this journey. Better health starting with you is not just an individual effort. I think it's a community-wide effort. It's a commitment from our industries. It's a commitment from our civic organizations. It's a commitment from our churches. It's a commitment from our elected officials to take a stand that we will be a healthier community. When you look at the health status today, the statistics that they look at are many things that we can influence. In our own lives, if we were female, when was the last time we had a mammogram? If you look at the obesity rate in our county, there should be something we can do about that. One of the statistics they capture is inactivity. Most of us can start being active in something. As an individual, we have to take that personal responsibility, but as a community, we have to ask the entire community to step up to the plate and look at the challenges such as substance abuse. Substance abuse often leads to violent crimes. One of the statistics captured on our community as it relates to health status is the number of violent crimes in our community. Robeson County, again, is at the bottom of that list because of the higher rate of violent crimes. We have to take a stand. The healthcare institution in your community is taking a stand for that today. Not just in the name, not just in the tagline, but committed to this community that we're willing to partner with anyone who's willing to partner with us. It says if we want to stop violent crime, maybe we need to look at the substance abuse issues and stop prescription drug abuse or other activities of criminal minds in our community. You might say that's somebody else's responsibility, but really it starts with each one of us as an individual. One person can make a difference. I've made it my commitment very publicly that I am committed to making a change and to be a catalyst for that change in this community. I ask you to join me in that effort. Take up that challenge. Don't leave it to somebody else to try to change our community or to make it better. We're the people who can do it. Those of you that are in this room today, you're here because you had an interest, or maybe it was just a curiosity in what was going on today. Well, I'm glad you were curious. Because your curiosity got you here, and you're staying and you're at least listening, I think, to what I'm saying. I hope you're listening. Because you know our lives depend on whether we make that commitment today or whether we don't. From a personal perspective and leading a healthcare institution in this community, it is difficult to recruit to this community. When you look at those health status indicators, if we want the best healthcare, we need the best providers. To get a provider in our community, one of the first things they do is to pull up on the web the statistics as it relates to our community and the people that we serve. We just had a physician, an endocrinologist who is desperately needed in this community, who was willing to make a visit to our community. And when she pulled up the statistics, called us back and said, "Oh, thanks. Crime rate is too high. I wouldn't feel safe there." That's a sad statement for our community. My challenge to you today is to celebrate Southeastern Health, to applaud what the board did in making the decision to change the name, to pay attention to that tagline and say, I'm willing to be a part of the tag game. I think many of us played tag when we were young. This tagline says, you're now it. What are you willing to pick up and do? What challenge are you willing to commit to? What little step are you willing to take along the journey? I'm proud to be a part of Southeastern Health. I I'm proud to be the President and CEO of Southeastern Health, and I realize the awesome responsibility that it has with it. But I know I have great people around me that are willing to go wherever I choose to go. As employees, I thank you for that. To the community leaders, I thank you for supporting this organization. For those in the media that are here today, thank you for your interest in what we do here. We do make a difference. We continue to make a difference. And our vision is that in the future, you will see more activity from this organization